Namaskar, salam, sat sri akal, and welcome to you all. From the platform of DIH, I welcome you all today on a very important topic of these days, that is fever, and especially dengue. So one thing I must tell you all, that fever is not your enemy. Fever is your friend. Uh, Often people start taking crocin or antipyretic medicines even at 99 or 100 temperature. But mind you, even 104 is not considered fever by many doctors. So, and fever is a friend. Why it is a friend? Because it is telling you that there is some infection. It is fighting the infection on itself. On it's increasing your immune system. That is the indication that your immune system is working. So let the fever work. Let your immune system kill the virus or the bacteria or the infective agent. But if you actually require medicine, homeopathy is the best option in my opinion. Even for dengue, normally dengue can go take 3 to 14 days. With homeopathy medicine, it goes very quickly. Even hemorrhagic fevers are handled very nicely with homeopathic medicine. And today, the speaker that I'm invited to talk about fever and dengue and the clinical tips is Dr. Sadath Sait. He needs no introduction. He's such a brilliant doctor. People know him all over country, I will say. He passed out from Father Muller College in 94, and after that he has held posts as State Secretary, Unit Secretary, State Committee member of Institution of Homeopathic Kerala, and for many years, and even now he is the State Committee member of Qualified Private Homeopaths Association. This was regarding his post held in education, but personally I will say he is passionate man. He is passionate for his love for homeopathy. He's a lot into homeopathic activism in Kerala, and they have a very beautiful exchange of knowledge which he has spearheaded. I will say he's a daredevil doctor. He takes cases no other doctor touches. So I welcome you, Dr. Sadath. Please be here. I welcome from the platform of DIH, Dynamic Dreams Innovative Homeopaths. So I welcome you.
Thank you, Anupam. Thank you for lovely introduction. Okay, as we don't have time, too much of time, let's start immediately with the topic.
Right.
Is that okay?
Right.
Okay. Let us think about first fever. Fever basically, every kind of fever comes to our clinic. From COVID to dengue to viral fever to pneumonia to every little thing, every little fever comes to our clinic. Usually nowadays people started coming directly. Otherwise, we used to get it from, they took crocin, they took the paracetamol, they took injections, and it doesn't come down, then they come to us. As a doctor, or if this for the juniors, if this for the knowledge of juniors and public, I'll go for most of the juniors will listen to it, or most of the seniors will listen to it. So we'll stick to the medicines part of it. The dengue is almost like first 1 or 2 or 3 days, it is almost like any viral fever. Then the third day or second day, dengue positive will come up. We'll have to do the card test or dengue test for that. Once the dengue problem comes in, what is the difficulty, or what will be the problem first we are facing is platelets will come. That is the most dangerous part in treating dengue. What other people do is they just immediately, once they see the dropping of the platelet, they immediately admit. What I used to do is, I had a lovely case who didn't ask them to go to medical college, came directly to me. The platelet count was 15,000, which is hardly 15,000. For 2 days, it became to 1.5 lakhs. How? Homeopathic medicine. There are medicines like X-ray. X-ray is one of the best medicine. X-ray 30 is one of the best medicine possible for the dengue. Then the second medicine is phosphorus, Epitorium. And these three things, even we say the Carica papaya tincture or Carica papaya 30, it gives much better results. Carica papaya, people take it the juice of the carica papaya leaves the people takes it, but doesn't give in a practical experience as much as result in X-ray, phosphorus, and epitorium. These three medicines are more than enough for any dengue fever or any sort of platelet down to be better in 2 days. You will have to keep monitoring the platelet. That's the only thing you'll have to do it. Every day you check out the platelets. You don't have to do all the CBC and stuff like that. Only ask them to do the platelet count because we'll have to take care of the patient's money matters also. And 2 days, nothing more than 2 days.
That's wonderful.
That's my experience.
That's wonderful.
X-ray is one of the best medicines.
Okay.
X-ray group, there's another one, radium bromide, but radium bromide doesn't have this quality of an X-ray.
Okay. I'm
It
hearing
works
it for the
slowly.
first time. X-ray for dengue, I'm hearing for the first time.
Yeah. X-ray, it increases the platelets like you can even check every hour if you want.
Miraculous.
And the best part is that if it is too low, you will have to give the medicines every 2 hourly, even in the night. Because we are competing with something which needs a hospitalization, which needs that much of care.
Agreed.
Okay, so we'll have to give the medicine every 2 hourly, even half an hourly, 1 hourly also you can repeat. Nothing will happen. It is good medicine. We can just bring it out at any cost. No damages, nothing, no failures will happen with this 3 months. My guarantee. Okay. This is a thing medicine for the doctors. Then we will go for the different fevers. So usually what happens is kids comes to our clinic. Okay. Often with the nowadays people the adenoids. Kids sleep with the mouth open. They come out the adenoids, adenitis, and inflammations comes in. Okay. We all know that a lot of medicines are there. Any fever comes there, growth is there. We give belladonna, we give hepacil, everything is we keep giving. Agrafis nutans is one of the best medicines for adenitis fever. Okay. Another medicines which we can think about are sanguinaria nitrica, not sanguinaria. Sanguinaria, yeah, it's sanguinaria nitrica. There is one more thing is called scrofularia nodosa. That can even bring down the
glands. Any glands.
Any gland. We used to do it in other different, but adenoids, scrofularia nodosa is one of the best medicines. Calcarea iode, if it is with fever, what I do is with fever, I check it for the tongue. Tongue is the most important indicator for me to prescribe.
Me too.
Okay, so that keeps changing it. One is if you get a red tip, you get coating. What is the coating? What is the changes in the tongue? If it's cracked, depending on the medicines will change. But most of the tongue, I blindly I give a coating of the tongue. With most of the kids, I will have the red tip. It first medicine will be Restox.
Right.
Okay. And in fever, what I do is I give it 1 every 2 hours. Not I don't start with 30. I start with 1 every 2 hours.
Oh. Belladonna, okay. Which medicine?
Any medicine. Restox, belladonna, any medicine,
whichever
any
medicine.
medicine in fever cases until unless there is a pneumonia or lungs involved.
Okay.
Okay. Other than that, if it's just a viral fever, if the bronchitis is not set in, the pneumonia does not go to pneumonia, give the medicine a higher potency. Phosphorus is one of the best medicine if it's adenoids. If it's not adenoids, if it's for the viral fever, no prescriptions without phosphorus.
Okay.
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 Phosphorus 30. Phosphorus 30 is one of the best medicine. You can keep repeating every 2 hourly, every half an hourly, every 15 minutes. Fever will come down. What is the best part with the phosphorus is bronchitis doesn't set in.
Okay.
If it's in a viral fever, viral bronchitis doesn't set in with the phosphorus prescription.
Okay.
So we can get the this one is okay. This doctor, if you go in 2 days or 3 days medicine, he is better without any cough. Otherwise, what will happen is nowadays we get a lot of bronchitis cases after post-viral.
Post-viral, right.
Okay.
Is
So
this
we
a
can fill.
post-viral deafness? The cases are increasing in Delhi for this particular thing. Post-viral deafness, post-COVID deafness, or post-viral deafness. Are there any specifics for that?
Yes, causticum.
Posticum.
Causticum, again phosphorus.
Again, phosphorus, right?
Again phosphorus. Phosphorus acts any part of the body.
Mm.
It could be aphonia, and there will be paralysis of the nerve
Okay.
with COVID or any this one.
Any viral.
Again, any viral. Bell's palsy is common with viral fevers, especially with the sinusitis.
With the sinusitis, yes, yes.
Okay, so that is a part. See, what we have to do is we'll have to first find out what is the cause of it, fever. We'll have to check. We'll have to physically examine the throat. If it's a tonsillitis, medicine changes. Okay, as a throat is this one.
There are a lot many cases here where people fall ill because of excess of exposure to very cool AC or very chilled water.
Kali bike, argentum nitricum, medicines for laryngitis. Okay, this one, Hawking will come. Vyatia is one of the best medicine for that. There's another selenium is also a good medicine for that. Throat infection.
Okay, that's wonderful.
Okay.
Wonderful.
And if the patient comes with a Hawking, he has to clear the throat. There's no other medicine which we can think of other than Vyatia. Okay. These are the medicines we use it very frequently. But pharyngitis, another best medicine for pharyngitis, other than all this epacilfazine and everything, is glycerin. Glycerin also can be used for the cough after influenza.
Cough after influenza and low grade fever also. PU also.
PU also, and menthol.
Menthol. So this is wonderful, wonderful insight, Dr. Sadath. You have told us so many medicines which we were not aware of. I think not many people use phosphorus for fevers.
And eriodictone is another one. Eriodictone is another one. Okay. Cough after fever. Cough after fever, Oleum centale. If the cough is at the night, Oleum centale is also very good. Okay. Tonsillitis, if you tried and failed other medicines, gymnoclodus. Gymnocladus. Gymnoclodus. Okay. If there is a redness, again, gymnoclodus can be thought about. Okay. Other than all the other medicines, this can be thought about. Okay.
This is a new medicine again for me.
Gymnoclodus is very hardly used medicine.
Rare medicine.
Eucalyptus is another medicine for pharyngitis. Selenium is also another medicine.
Selenium?
Why? Yes, selenium. You read selenium. You read boric. Okay. Selenium we only give it for hair fall and what are called erectile dysfunction. But selenium is one of the best medicine for laryngitis. Even the paralysis of the vocal cord problems come for the singers.
Wow. Wow.
Think about selenium.
Wow.
Okay. Then comes the sinusitis. Sinusitis, one of the best and foremost medicine is Kalibai. Okay, Kalibai, give it in a higher potency of 1 m. Frequent repetition, 90% of the cases. You can even give 10 m also. Okay. Scutellaria is another one of the best medicines.
Scutellaria, yes.
Scutellaria. Scutellaria tincture also you can be used. Scutellaria 1 m also gives a good result. Okay. Along with the ancillary measures of steaming and stuff like that. And steaming, what you have to do is think this one is steaming is only for 2 minutes, not 1 minute.
Not 1 minute.
Okay. Don't put anything in that. Okay.
Okay.
Okay. What I do is there's a Gultheria oil.
Gultheria oil that is used for joint pains.
Why you can use it as that what
for steaming. Olfaction.
Not steaming. For the smelling. Yeah.
Olfaction, yes.
Olfaction.
Okay.
It will open like weeks. Much faster than your weeks.
Just wonderful. Just really wonderful.
Okay.
Okay.
Uh, so that's the practical. We are competing with the multinational or what are called specialty hospitals.
Specialty hospital. We are competing with big pharmaceutical industry also.
Yeah, yeah. So we will have to be quick. You cannot keep waiting. Okay, fever will take another 2 or 3 days. By the time we talk to them, they will take the paracetamol or they will gulp something else. Antibiotics also nowadays they start. The COVID we saw a lot of antibiotics.
Any tip for the patients who already taken paracetamol and symptoms are in disguise now? People usually come to you after taking paracetamol.
90% comes with the pneumonia. Directly it goes into the pneumonia. First medicine for the pneumonia is pneumococcal. You start if you see any lung involvement, pneumococcal plus what is that pertussin,
Pertussin.
pneumococcal and pertussin. Pertussin and pneumococcal. If you start the one dose, if you start give then indicated medicine, it shortens the treatment time.
No, I'm asking if patient come to you in disguise symptom, that is, he's taken paracetamol already.
Anything, sir. Anything, ma'am. We are here to treat that only. We are here to take care of what allopathy misuses, mismanagement.
Mismanagement, yes.
So homeopaths, we get most of the cases they take paracetamol of 10 paracetamol of 5 paracetamol. If still temperature comes in, when we get it, the case will be bronchitis or a bronchopneumonia or a full-blown pneumonia. So that is the beauty of we have to manage all this. If we hear the pneumonia word, what we do is we refer. Pneumonia is a pneumococcal. If you start with it, then the medicines can be Ipecac, antim-ars.
And you give all these in hypertension?
Depends. If you get a pathology, Ipecac is 1 m,
Okay.
antim-ars 30. It depends upon the situation.
And pneumococcal?
Pneumococcal always higher
High.
potency because
And
it's a
pertussin also.
no sort. It's a no sort.
So no, so and pertussin also.
Pertussin also high potency.
Okay. This is wonderful. Wonderful.
Okay, because all the no sorts action is higher potency. Lower the potency, it doesn't act too much of it. Go for the higher potency.
No doubt you have a big fan following, Dr. Sadath. You are so many, insights. अपने बहुत नई दवाइयां बताई हमें. आपके इतने फैंस होंगे, कोई डाउट नहीं है इसमें. बहुत फैंस होंगे आपके और इस वीडियो के बाद और भी बनने वाले हैं.
And Senega. Senega, never forget. It gave me the reputation what I am today for the COVID.
For COVID? Okay.
Yes. COVID, if you see the what a ground glass appearance of the lung.
I have used Senega in mother tinctures. You use in mother tinctures or mother tinctures?
Yes, mother tinctures and 3x. Okay, and Baptisia is another one of the wonderful medicine for your throat complaints. Baptisia. Especially if there is a deposit.
Okay.
Another medicine deposit, acetic acid, deposits in the throat. Acetic acid, mercaptan.
Mercaptan, yes.
Okay, we use Merc core and Merc
iodubras. Merc iodubras.
But try out for the mercaptan. It prevents even the pharyngitis or paralysis of the throat. Okay.
This is really wonderful.
Respiratory. If there is a respiratory inability to lie down, sleep apnea also happens. That we'll talk little later. Cough after fever during the lactuca virosa. Have you heard about it?
I've not used it. I've heard, but I've never used it.
Lactuca virosa is one of the best medicine even to increase your breast milk. Okay. Santin is another medicine for the cough. Osmodium, Oleum jack, Oleum centale. These things can clear off your cough after fevers. Eriodictin is another one medicine. Okay, if there is a pneumonia with pericontritis, if you will have to examine it. Asclepias tuberosa. And most of the people get inframammary pain while coughing. Lot of cough comes in after the fevers, no, and they get inframammary pain, especially for the females. Simisifuga is one of the best medicines.
Right.
Actia racemosa we give only for the joint pain medicines and some menstrual issues. Okay. This is something which we can think about it. Okay.
This is really wonderful, Dr. Sadath. Let us give our viewers some time to digest all the information that you have given. And we will be waiting for the next session. This session was so wonderful. And I'm sure all the audience will wait for the next session. We will have it very soon on a different topic then.
Thank you.
Thank you so much, Dr. Sadath. This is a really wonderful session. I have really no words to thank you, really. It was so many new medicines I have learned, and I am sure our audience will also enjoy this knowledge.
We have learned from our seniors. Now it's our time to give it back to the society.
Right, sir. Thank you, Dr. Sadath. Thank you very much. Thank you to you, and thanks to all viewers for watching this. And please wait for our next session. You can also comment in the to ask for the news topics that you want to listen to. Thank you. Good night for now.
Thank you.